What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, August 16th, 2024. If you're new to my channel, welcome to my channel. Maybe you just clicked on this video because you, someone you know, or a family member just tested positive for COVID. Well, you came to the right place. We talk about that and other viruses each and every day here on my channel. Right now, we are in the middle of a major summer wave in the United States. You don't hear much about it in the news, but it is happening. Other viruses are a problem as well. Norovirus. Mpox has been back in the news lately. Yes, there's a new, more potentially deadlier strain of Mpox that started in Africa, and it's starting to show up in a few other countries now. The World Health Organization has declared it once again a public health emergency of international concern. So yes, it is an emergency once again. That's something we track as well. And of course, cold and flu season. It's right around the corner. It's just a month or two away. Colds, flu, RSV will all be making their rounds on top of the ongoing COVID pandemic. So you really need to be informed with what's going on. I'm all year round. You want to stay informed with what's going on? Subscribe down below, give this a thumbs up, hit that notification bell, share these videos with anyone you know, and leave your comments down below. This has been a major summer COVID surge, and we've seen a lot of famous people test positive. Well, another one tested positive. Barry Manilow has tested positive for COVID, and his San Antonio concert for Thursday night had to be postponed due to his COVID-19 test. Rod Stewart recently tested positive. Yes, it's been a long summer. My COVID positive archives over on datareport.info, of famous people, it has grown to a lot more names have been added to the list this summer because it's been crazy. The Olympics, there were a lot of positive names that I added for that. Mpox, we just talked about that a minute ago. We're going to talk about it twice today. Mpox is making its rounds in the news once again, and now Pakistan records a case of the new variant of Mpox, reportedly the first in Asia, so that's not good news. Wastewater Scan did put their weekly data thread up on X, and I wanted to read that to you. They say COVID-19 SARS-CoV-2 is in the high category nationwide with high concentrations and an upward trend over the last 3 weeks. All regions are also in high category. Influenza nationally and in all regions, flu A and flu B remain in the low category and not in seasonal onset. As we get into September, I think when we do our wastewater checks, various different sites, or Wastewater Sunday, we'll start paying more attention to those other viruses once again. As of now, we'll probably get back to looking at Mpox more often, but more on that in just a bit. H5 influenza, H5 has been detected in 9 states, and those states include Arizona, California, Colorado, Iowa, Idaho, Michigan, Minnesota, South Dakota, and Texas. And as of August 15th, 2024, Colorado, Iowa, Idaho, Michigan, Minnesota, South Dakota, and Texas have also had infected cattle herds reported. There are no new states added to the list in the last week. Norovirus nationwide. Norovirus is still in the medium category with medium concentrations and a downward trend over the last 3 weeks. The Midwest and Northeast are in the low category. And then they say you can visit your website for more information. So, yes, their website does have more information. Peru. This is interesting. Peru. Long COVID affects up to 20% of patients. The aftermath of COVID-19 continue to affect the lives of thousands in Peru with symptoms that persist in some cases for years. Yikes, that's not a good thing. And we're seeing this in more and more countries. starting to be a thing. All right, we want to do something from Australia. I haven't talked about Australia in a while. Dennis, the COVID info guy, constantly tweeting out stuff. I just haven't added some things from him in a while because, quite frankly, as you have been seeing, if you're a regular that watches my channel and my daily videos, it's been quite busy lately. Today we do have a little time for Australia, and this is, aged care facilities, senior living facilities, and this is the this is the update for that. Active cases, 1,538, that's up by 92. Active outbreaks, 207, that's up by 16. Residents, 1,147, that's up by 57. Staff members positive for COVID, that's 391, that's up by 35. Reported deaths in 2024, wow, 826, that's up by 15. Remember in the early days of the pandemic, we tried to prevent infections in care homes? Not just there, but all around the world. There's still another 826 that died. Yikes, that's not good. Wanted to share this with you. X actually had a little trending thing called X users report surge in COVID-19 cases. In other words, there's a lot of people saying that they're positive for COVID. They're talking about COVID. Yeah, something that's actually trending. And I went to one of my other X accounts that's non-COVID related. It actually came up there as well. So it's actually outside of the COVID community as well, at least as of the time of me finding this. And it talks about the United States currently experiencing a significant resurgence of COVID-19 cases, marking the largest summer wave in at least 2 years. There's been a few articles out there today running with that, but the good news is, and I'm going to tell you, there is good news. It does look like we are getting very close to that peak right now. Some things may have already peaked. You'll see that in the new CDC data in just a little bit. Reminder, my website, datareport.info. I do a daily thread of the news stories used in the pandemic update, and we will have one for today. There's also been an update that I posted yesterday. Let me click on this actually. JAG, remember the school that was in, I believe this was a school in Alabama. There's an update to that. That school was closed today on Friday due to COVID-related illness still. I mean, it was silly. 2 days for a COVID outbreak being closed, that's not enough time. And if you actually read the full article, they talk about, well, we're going to disinfect the school, do this and that. Okay, COVID's an airborne virus, yes. Clean the surfaces is good for other viruses and whatnot. And I guess it could be good for COVID as well. But again, masking is something that's going to work even better. They're not implementing masking. All right, moving on now to the latest allergy map. And this week, or well, for today, 47% of the country is in medium status. We do see red, and this red over Pennsylvania, southeast Pennsylvania, and over New Jersey, northern Pennsylvania, New York. Yeah, I've been feeling it today. My allergies have been bothering me. Taking a look at what's going on across the plains, red there, and then a lot of orange across the country. And the places that were bad early on, like back in the late spring into summer, are not as bad in the Pacific Northwest now. Moving on now to the latest air qualities, and check this out. Kind of a mixed picture, but you will see when this comes up that there are still problems, but there are also some spots that are not doing bad. And take a look in the east. Wow. Yes, this actually continues to get worse, the northeast. Now, mind you, a lot of this is elevated, the wildfire smoke, but the air quality centers are detecting that the air quality is not great. And take a look at this. Much of New England is in the orange, and even red's showing up. And you can see it's traveling its way from Canada. But I do have good news. There's a warm front that's somewhere like right back here across the Ohio Valley. That's going to be moving east and northeast. My hope is that warm front can maybe push this out of here. That's my hope. But we'll see if it actually happens. Bad air quality is a problem in Canada still, and even North Dakota. Look at North Dakota, a lot of red there. But slightly better today across portions of the Four Corners region. The Pacific Northwest is still bad, but it's not as bad. I mean, there is still, look at California. We're still seeing some reds and oranges, even maroon. Yeah, that's not good whatsoever. Moving on now to heat-related illnesses. It's been hot once again. At least here in Pennsylvania, it's been very hot today. So heat-related illness calls, they could go back up once again. And we have not seen them really drop all that much around the country. So there's still a problem. A few more weeks we'll start to watch them drop. Taking a look at this. Yes, I have another place where I talk about climate, weather. Haven't done anything yet there today. Hope to do something this evening. and it is Climate Data Report over on X. Taking a look at Philadelphia EMS calls for yesterday. 830 were reported on Thursday. Let's do a live look at what's going on with EMS calls in Montgomery County, Pennsylvania right now. We're late with our update today. It's almost 6 o'clock. So what would be happening at this time of day? Well, we do see that there are currently 11 calls in Montgomery County for an ambulance, 1 respiratory emergency, and a few other random calls at this time. Chester County, Pennsylvania, we do see a sick call, emotional disorder, respiratory difficulty, seizures, injured person, stroke's never good, that's in Parksburg Borough, and we do see a couple other things going on. Not terribly busy. Taking a look now, let's go over to Walgreens and we'll see what's going on there. The national positivity rate this week was 38.3%. That was down ever so slightly. I'm thinking it's going to continue to drop at this point. Testing's going up slightly, and plus, I think we're going to start to see cases dropping soon. I'm really confident about that. Not everywhere. It will vary from state to state, even city to city. Let's take a look at what's going on with the viral level of COVID in Canada. It's moderate at this time. Flu A, Flu B, and RSV are all low at this time. Taking a look at some new CDC data, and it's kind of mixed. You're seeing here, while there are still some areas where epidemic status for COVID is growing or likely growing, you're starting to see some more green show up on the map. You know what green means? Those are places where epidemic status is likely declining or declining. It's likely declining in Alaska. It's likely declining in Hawaii, Louisiana, Florida, and New York State at this time. Although New York State bears a question mark. I'll explain why when we get over to New York State. Mind you, this data is from the past few days. Today's data from New York State shows something a little bit different. Yeah, New York State had a little bit of a rise today. And it's still growing in several places. The Mid-Atlantic region, or parts of that, we'll say Virginia, West Virginia, and then you get back a little bit more to the west, Kentucky, Tennessee, Alabama, Georgia, South Carolina, still growing, Illinois, still growing, Minnesota, North Dakota, South Dakota. And look at this. Here's a surprise. It's still growing for some reason in California. There are a few wastewater sites that are continuing to rise there. Taking a look at more new CDC data. Now, this is not good. We did have a little bit of good data there just a minute ago. This is not good. We still have the wastewater COVID-19 national trend. That's still very high. It rose again. Looks like maybe it's going to try and slow a little bit, but it's not there just yet. And taking a look at this, the number of wastewater sites that are in the low category, I honestly don't remember the last time it was this low. 0 to 19% COVID detected, rise detected, which is, the lowest level. There's just only 23 sites at this time in that category. Yeah, my friends, that is not a good thing whatsoever. And then you come down to the next one, that's 118, and then the really light shade of blue, which is this color right here, this really light blue color, 40 to 59% COVID detected, 310 sites. Orange, there's still 469 of them, and red, that's the highest level, 340 of them. Yeah, that is really, really not a good thing at all at this time. Drum roll, please. We do have the new COVID variant update from the CDC, and I believe, we'll see if I'm right about this, I believe as of right now, KP 3.1.1 is potentially going to clear the board. Why am I saying that? Because it has jumped way ahead now. It is now at 36.8%. We've seen variants where they've taken over this summer, and then another one comes and replaces. Well, as of right now, KP 3.1.1 is at 36.8%. KP.3 is at 16.8%. KP 2.3 is at 14.4%. LB.1 is at 14.1%. LP.1 is at 4.1%. KP.2 is down to 3.2%. Then you do have some other variants here. My point, you can clearly see here, there are less variants. Yeah, there's still a whole bunch that are below 1%, but a lot of them are getting knocked off pretty soon. And KP 3.1.1 may not completely clear the board, but it is taking some of these variants that did not gain much or that are very old, like JN.1, KP 3.1.1. It is a distant family member of it, but the point is, it's really starting to get up there in percentage, and I would suspect the next update, it probably goes over 40%. So that is the new CDC variant update. Take a look at this. You know how we can average all the wastewater sites in a state? Texas. It's still coming in at very high levels with 18 sites reporting. Four Corners region, New Mexico, Arizona, Utah, Colorado, very high levels. California, Oregon, Washington, very high levels. You get the point here. There's still a lot of places in very high levels. New York State is actually now at high levels. Which is interesting because they were actually fairly low for much of the summer. New Jersey still comes in at low. Pennsylvania is high. You can see North Carolina and Tennessee, South Carolina, very high at this time. Florida still comes in with very high with 18 wastewater sites reporting. And what I mean is, when I talk about the number of wastewater sites, say very high, so you have 18 sites. Average them all out, well, it equals a very high result. Alright, moving on from this, let's quickly take a look at some wastewater scan stuff. I did tweet something from Wastewater Scan yesterday evening. It went absolutely bonkers. You know what? I should have pulled that tweet up. I didn't. That's okay. I tweeted about Mpox cases being detected in the wastewater in San Francisco. Now, for COVID, real quickly, we do see COVID is dropping at this time. Take a look at this. There are some detections of Mpox, and they're saying here that it is the clade 2, which I believe that means that is the old strain. So, the old strain of monkeypox, Mpox. Gotta say it right. It is now called Mpox. If you're just seeing Mpox stories for the first time in a while, the name has changed. It's no longer called monkeypox. It is now called Mpox. I do believe this is the strain from just a couple of years ago, meaning the new strain. It's not here in the United States as of yet. But it has been showing up in wastewater in a few places, and both of the San Francisco wastewater sites are showing it. It's also showing that there are some cases, or potentially case of Mpox in Newark, New Jersey as well, I believe it is. Let's see here. We've been showing Newark lately. Let's go down and take a look here. And, ooh, take a look at that. Wastewater continues to rise there for COVID. And you can see here, yes, there have been some detections. Actually, multiple detections. There's only, I believe, 4 wastewater sites, or 4 cities in the country that right now are showing any detection of Mpox. Someone actually did the work and posted on X that they only found 4 wastewater scan sites with detections of it. Alrighty, moving on. We do have more stuff to take a look at. Let's take a look at emergency department visits. We got some good news here for you. We're just going to take a look at the national level, and that should come up here in a moment. Here it is. Take a look at this. It would appear emergency department visits with people diagnosed positive for COVID have at this time peaked and are starting to drop. So that is some good news. We'll look at all the different states that report. Not every state reports, but we'll look at all the different states again tomorrow. Alright, moving on now to New Jersey, where 70 out of 70 hospitals are reporting, so it says. The number that they pulled out of a hat today is 515. I hope that's the correct number, but you never know with New Jersey. 10 people on a ventilator, 52 patients in the ICU, 85 discharges reported at this time. And if 515 is the correct number, that means New Jersey would be dropping. Something that has not dropped today, and that is New York State. They reported 2,186 new cases, which is slightly, not much, but just slightly higher than what they reported last week. At this time, you can see it's leveled off a little bit. I don't think this is going to lead to anything major, but now we'll have to watch what happens. Hopefully, New York State will continue dropping pretty soon. Taking a look at New York State's hospitalizations, that did not rise today. That is at 1,224 with 125 people in the ICU. All right, drum roll please. We need to refresh this. This is the latest update now from LA, and yes, it is as of August 15th. Hospitalizations in LA continued to rise. It's up to 462 now. Deaths have not rose yet, but take a look at this. Cases on the chart. They are showing signs of dropping, but yet the daily positivity rate has gone up to 14.3. Hopefully that will start dropping soon. We are seeing here this case drop starting to become a little bit more significant, so it's something to watch. Wastewater on this chart, though, also does not agree with that. It's still rising. Emergency department visits have also still rose, and it looks like it's around 4% now, or almost over 4% of emergency department visits are people diagnosed with COVID. Alrighty, folks, that does it for the Friday edition of the Pandemic Update. We'll have another edition of the Pandemic Update again on Saturday. Remember, my website is datareport.info. Here it is. Here's the homepage. It is just filled with information. Anyone can sign up to become a member and post. It is free to do so. Want to see more updates like this? Subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this with anyone you know. And leave your comments down below. I'll see you all again tomorrow. Until I see you again next time, stay safe, everyone, and have a fantastic Friday evening. And have a safe weekend. Try to, anyhow. Bye-bye. Thanks for watching.